Hello, everybody, and welcome to another episode of the Nursing in Style podcast, where we empower nurses to lead, innovate, and own their piece of healthcare. I'm your host, Danielle R. Jenkins, founder and CEO of Nursing in Style Consulting. And today we have what I believe is one of the most important conversation every nurse needs to hear, and definitely every nurse leader needs to hear. As nurses, we're trained to care for others. We advocate for our patients. We support families during some of the life's most difficult moments, and often everyone else needs before our own. But what happens when a caregiver needs care? What happens when stress and burnout and mental health challenges or an unexpected drug screen threaten not only a nurse's well-being, but also their livelihood and professional license? Today's episode is titled "The Silent Crisis in Nursing, Mental Health, and Protecting Your License." And my hope is that this conversation not only educates, but also helps remove the stigma surrounding mental health in our profession. Seeking help should never be viewed as a weakness. It is one of the strongest and most courageous decisions a nurse can make. I'm honored to welcome an incredible nurse leader, an advocate who has dedicated her career to supporting nurses through some of their most challenging moments. Joining us today is Brittney Majefski. I should have practiced that. Brittney Majefski. Brittney has been a registered nurse since 2013, bringing experience across direct patient care, infection control, nursing leadership, and psychiatric mental health. She previously served as assistant director and director of nursing at a residential treatment center for adolescents while also educating future nurses as a clinical instructor in an adult and elderly psychiatric mental health program at the University of Texas at Austin School of Nursing. Today, Brittney serves as a program director for the Texas Peer Assistant Program for Nurses, known as TPAPN, where she leads efforts to support nurses experiencing mental health and substance use challenges while helping protect both patient and the nursing profession. She also serves on the board of directors for the National Organization of Alternative Programs, advocating nationally for nurse wellness and recovery. A certified psychiatric mental health nurse, Brittney has contributed to both Texas Nurses Magazine and the Journal of Nursing Regulation and has presented research at conferences across Texas focusing on reducing the stigma and advancing mental health awareness within nursing. Outside of her professional life, Brittney enjoys spending time outdoors, building projects, reading, traveling, and making memories with families and friends. She has been happily married for 18 years to her husband, who served as a first responder for the city of Austin. Brittney, thank you for joining us today. I know this conversation is going to educate, encourage, and empower nurses across the country, and we are honored to have you on the Nursing in Style podcast. Welcome.
Oh, Danielle, thank you so much. I am so excited to be here and speak with you and learn from you all, and hopefully be able to, share some of the insights that this work has provided. So thank you so much for having me.
You are most welcome, and your bio reads like a beautiful book. You are one important nurse.
Oh,
You have been busy being a true champion for nurses. There's so much that happens behind the scene that other nurses don't realize is the work of people like you that helps us to move forward in certain areas. So thank you for what you've been doing. So tell us about your nursing journey and what inspired your passion for mental health advocacy.
yeah. So I mean, as you so eloquently presented, I've been a nurse, since 2013, and most of my nursing career has been in the psychiatric mental health nursing realm. That's definitely my passion, and a lot of that was spent with, of course, children and adolescents in the residential behavioral health realm. But through that work during COVID, I think to answer the question of how did I kind of get into this work, is I've always been an advocate for mental health, but during COVID, I think that's where the first time it hit me. I saw so many of our peers, our colleagues, ourselves start struggling more with our own mental health and wellness. And it really struck me when I had a dear colleague of mine uh, reach out to the TPAPN program And the truth is, I've been in this program for 3.5 years as the program director, and before that, even as a mental health advocate, I knew this much about it. I knew, oh, this is a program that's available for nurses, but I didn't know enough about it.
Wow.
And I was so encouraged because what happened is I recognized that I needed to be more informed, and so I called up to TPAPN and got to speak to the amazing case managers that are so gracious enough to have me and put up with me. They did such a good job of explaining, in that moment what TPAPN was about, how they were really advocating for, nurses' mental health and their continued practice in the nursing field, and they helped walk me through how I could be a better support to my staff and my team, and through that, I really became so interested in doing this work, and
Mhm.
blessed enough to have the opportunity to come and kind of flip this advocacy from not just patients but to the nursing profession. And I've have been so happy to do this and allow, help serve nurses in this way and give them the opportunity that they deserve to heal, recover, and of course, do the amazing work and continue to do the amazing work um, that that we as nurses all strive to do.
Right. Now I find it interesting. I didn't even realize we had this in common. So you had a friend that had some struggles and
Mhm.
was trying to be a resource to her and finding yourself short.
Yep.
When I think back on this story, I had someone very near and dear to me that also struggled. She struggled with a lot of mental health issues from childhood traumas. She struggled with drugs off and on. And when she became a nurse, she was off for a while. And then, as life traumas began to hit her, the weakness was falling back into drug seeking.
Yep.
And because it's an area that tends to get pushed up under the rug for doctors and nurses, it
Yeah.
gets ignored until it becomes too obvious. And I wished at that time that I knew about a program such as TPAPN to have given her some help, because this nurse ended up ultimately losing her license. She was never placed in any form of protection through any board programs,
Yeah.
and she really had to kind of get it on her own. And you know what they say, when you're the strong one, who checks on the strong?
Exactly.
And she was considered to be the strong one, believe it or not,
Of
that
course.
suffered silently. So,
I think, that's something that we see a lot in this work, and I tell people all the time that, our nurses that are in our program are incredible. They're doing incredible things. And I love because I think you led with this and I loved what you said is seeking help is a strength. And
yeah,
that is one of the bravest things we can do. I will self-admittedly say historically, there were times where, I you can talk about this all day long, but actually doing it and seeking help and saying I need a break, I need to reach out to someone is a lot harder. And so I love that you bring that to the table, because that's the truth, is it is brave and it is a strength, and there is a way, I think, collectively, especially in the nursing profession, we can help one another
yeah.
with that strength.
So, why do you think conversations about mental health and substance use still remain taboo in nursing today?
So, I mean, in one word, stigma. There
Mm,
is, whether you call it fear, bias, stigma, it's all the same thing. And I think especially for those in healthcare and that are providing the care, the truth of the matter is that we as nurses are human beings. We're human beings, right? And so we, just like all of our patients that we are trying to help, are subject to develop the same, medical conditions in the same way, whether that is in the form of congestive heart failure or substance use disorder or other mental health conditions. So I think in this world, when we're talking about, specifically in the helping professions and healthcare professions, why it's still taboo is the stigma and fear that goes along with it. There is, for far too long, I think, rather than, being open and effectively educating ourselves and one another
Mhm.
on these things and addressing these concerns, we've kind of pushed them aside. And, at the expense of many of our colleagues, unfortunately, that have, tried to, as you say, you had that friend that tried to do it alone, and that
Yeah.
is so incredibly challenging. And the fact of the reality is not speaking openly about these things that, such as substance use disorder or other mental health conditions, it it impacts our profession, of course, negatively, but it can actually also create patient safety concerns because we create
Mm.
these environments that people don't want to do help seeking behaviors because they're afraid to come forward and tell their supervisor or their peer or colleague, "Hey, I'm really struggling. I'm finding that I'm having a really hard time," and if we are more educated and more open about these things,
Mhm.
we will be more likely to have individuals come forward and seek that help and prevent much more significant effects in the long run.
So as you were speaking about that, the word safe word kept coming to my mind.
Hmm.
So, working in a hospital, working on nursing units, working in a place where we had to be superhumans,
Hmm.
where's our safe word? Where's that safe word that I can say? And if you were my manager, Brittany, and
Hmm.
if my safe word was sage, that I can just say sage, and that that means it's a meltdown coming,
Hmm.
or I'm right there in this phase and I'm trying to keep my face together in front of this patient, but I really need some moments.
Yeah.
I need to decompress. So when I started thinking about cops, this came out during 2020. I mean, 2020 had some eye-opening moments for us, right? It made the world realize that mental health is a real thing that's still happening and impacts regular people. It impacts
Exactly.
people, right?
People,
Humans,
period.
right?
Yes,
Period.
humans.
I love that you said that just like we can, other people get hypertension,
Hmm.
congestive heart failure. Nurses and doctors get that too. We are humans, right?
Exactly.
So that was really like, haha, right? Bipolar disorder, yeah, it really can come on. Schizophrenia, yeah, can really
Absolutely.
be something that, you have some things that trigger. So where's our safe word? Where's our moments? Do we
Yeah.
even assess and pay attention to when we're going downhill? We're really good as nurses with assessing other people. I'll be in a
Hmm.
grocery store and be like, ooh, cystic
That's
fibrosis,
right.
right?
Yep.
Ooh, hope he
Yep.
took that medicine today. That jugular vein distension not looking too good. But we
That's
won't do it to our own colleagues to support and assist them and say, hey, did you take
right.
your blood sugars today? Are you
Right.
good?
Are you all right? Let's
Yeah,
check in. Let's look underneath a little bit that, like, okay, they passed me and said they're fine, but are they fine?
that
What are the
part.
other behaviors that are telling me that they're not fine and I'm just taking it like, "Oh, they're all right."
Yeah, I say that we have to create a community of safeness, Brittany, so that when our fellow nurse says, I'm okay,
Mhm.
we find out if they're really okay. I heard of a story where a nurse working on a unit, everybody said, you okay? Yeah, I'm okay. I'm okay. Committed suicide that same day,
Yep,
right after her shift. That's devastating to
it
be
is.
in a room with healers and no one to see you.
Right.
So going through mental health issues, a lot of times we don't even know what that looks like. People don't even know the full definition of what depression looks like. They think you have to be sitting in a corner crying and looking like you got some hats on and some blueness when
Mhm.
depression doesn't look like that. Being a mental health expert, can you give what does depression look like that seems to it a lot of times it just passes right over?
Yeah, so I love this question because I think it's really, it is challenging, and one thing that we're really good about doing as nurses is masking.
Hmm.
We can put on a face, right? We
Mhm.
can absolutely compartmentalize really well. I always say we can compartmentalize to a point, but I always use the word like our brain eventually starts leaking. You brought up trauma earlier, and I think that nurses have a higher rate of whether it is childhood trauma because you decide you go into this profession to be the healer and be the helper as a response to that, or you have trauma inherently. I don't believe that there's any one of us that's been working in this work for a very short amount of time that hasn't experienced some form of trauma related to the profession itself, work, secondary, tertiary, primary, you name it, vicarious, second victim syndrome, so many different things. And so to go back to your question on, what does it look like, depression specifically, or anxiety, or how can I tell if my colleague is okay?
Mhm.
So often we can't. But that's why it is so important to know very clearly that we have put together and in place, especially as leaders, speaking to y'all, we have put together a informative, educated, safe works work environment where we feel comfortable enough saying, I am human. I'm not having the best day today. I'm trying to leave it at the door so I can be here for my patients, but I'm going to be real with you, Danielle, and I
Mhm.
might need a minute. I'm going to sage. I might need a minute. And we've got to create environments in which we truly, when we ask someone, are they okay?
Mhm.
One, we know what to do when they say that they're not. Right? We
Mhm.
have resources in place that we can offer them if they are not okay. And we could talk
Mhm.
about, TPAPN may be one of those, but there's so many various resources. And and two, yes, there's the common things that you may see, like disengagement,
Mhm.
like, things that we see regularly, somebody that used to be super engaged, they'd come to work early, leave late, pick up everything, they may stop doing that. Another thing I think that we saw a lot around, post-traumatic stress
Mhm.
is, we're typically a lot of individuals are empaths or very compassionate, and
Yes.
you get that compassion fatigue, or all of a sudden you've just put up such a boundary because you've had to compartmentalize this trauma for so long that
Mhm.
now you no longer can feel it, and that can be very significant. So I think one of the most important things we can do is not only be there for each other, but do that self check-in
Yeah.
every day, understand our own baselines, and what's my baseline, right? We talk about baseline all the time in nursing
Yeah.
from, no matter what we're doing. So what is my overall my mental health baseline today,
I
or
love that.
and go from there and try to ensure that there's someone, something, some resource that we know that we can reach out to when it's suffering.
I love that. I challenge nurse managers, if you're watching this today and you have a team of people, create a toolkit for your floor. What's your safe words? What do we do about mental health awareness for us, not our patients, for us? I
Right.
often say, as nurses, we are the first patient. Let's take care of us first so that we can be fully alert, fully present, fully available to take care of our client, our patients, so that we don't put things at risk. And so I challenge you, nurse managers, Sage, let's get us a safe word. Let's get us a toolkit on how we're going to check in on each other's and be each other's keepers. And my sorority, we like to say, my sister's keeper. So let's talk a little bit more about protecting the license in a sense of
Yeah.
when people go through experiences with drugs or mental health, they get very afraid to say that I have this issue going on because I don't want to lose my license, which can directly impact my livelihood. So I'm just going to act like this is not happening or push it under the rug. So,
Mhm.
what is the biggest misconception nurses have about drug testing? And what medications, supplements, or everyday products can unexpectedly affect the drug screen?
Yeah, so there's a lot of layers to that onion. So I'm going to start, if that's okay,
Yeah.
with talking about an opportunity here in Texas, specifically around those that are struggling with substance use or other mental health conditions, and that is, of course, the TPAPN program. And so, what it is, just to kind of quickly go into that, and then I can talk about definitely some highlight. Things to kind of monitor for, be aware of when it comes to drug testing, and even just over the counter things to be mindful of as nurses in general. But, for those that aren't aware, TPAPN is what's considered the alternative to discipline programs. So to go back to, is there a way, the fear of, am I going to lose my license? Well, this is an opportunity. And what we want to do is have leaders so informed and so educated that they create TPAPN friendly policies in which, if they've identified somebody needs help, instead of just waiting until there is a patient safety situation, we intervene early. We
Yeah.
get that individual, we refer them to alternative to discipline, allow them the opportunity to come to the program. We help monitor nurses that are struggling with either substance use or other mental health conditions that could potentially impair practice, so that
Mhm.
they can stay in practice safely, continue to work while they're going through recovery. And hopefully in doing that, they can avoid any, loss of job, loss of license, and much worse, harming themselves or a patient. And so, our whole goal is to encourage individuals to, refer early and often.
Mhm.
As you said, Danielle, you even, and I love that. If you're not sure if TPAPN is the right fit, if a nurse is in need of TPAPN, or you yourself are in need of TPAPN, the team here does an amazing job. They will answer you honestly and say, oh, well, here are some other things that may be appropriate, or, that would be a good opportunity if you'd like to come in. We can help you get that balance, that support and accountability that oftentimes during recovery you may need, and in order to have that support and positive outcomes.
I like that. So let's point out what medication supplements or some of these common
Yeah.
names that we take and we ain't thinking anything about it. And then we show up at our jobs today and it's random drug test day.
And it's random drug test day. So this list could really be exhaustive, but I'm going to start with kind of some of the common ones that we have seen, and especially in our state. So if you're listening nationally, your state may have different laws, different programs, but this is speaking specifically, in Texas. One of the number one things that we see that happens: CBD products. So we've got CBD products in everything, right? You go get a pedicure, they got CBD oil,
Mm-hmm.
you don't even know it, and they're
Mm-hmm.
rubbing that lotion on you. Maybe you take CBD and in any form, and maybe
CBD
it tells
drink.
you it's THC free, because oftentimes it's like there's no THC free. Well, what I have learned in this work, and what our amazing toxicologists and medical review officers have shown me, is that it is so, with the sophistication of testing, of toxicology testing these days, almost none of those products, while the level of THC may not be actually mood altering or impairing,
Mhm.
you might still test positive for
Really?
THC. Even if it's a CBD product says no THC, you can
But
still test
but what
positive.
what if I got the arthritis?
Uh-huh.
I don't have the arthritis. I'm not putting that in the atmosphere, but
Oh, lucky.
our older nurses and our nurses who's been athletic over the years,
Yep.
these knees are hurting, and I got to do this 12 plus hour shift. And the CBD cream is what people gonna tell them to put on because it really kind of takes down the pain. So you telling me that my nice good creams might show up on the drug test and
They
cause me to have some issues?
They absolutely could. They absolutely could.
Whoa.
So that's why I tell everybody, I'm not telling you what to do, what not to do. I'm here, we're here just to inform you that that could happen, and we cannot tell the difference in, if you're utilizing, if toxicology isn't quite that sophisticated enough to tell the differences. If you are, you taking the Marinol pill that we administer for appetite,
Right.
or CBD, or are you utilizing THC for other reasons? And it's challenging to tell that, and it is something that could land you, in an investigatory process. So it's just worth knowing. Always know what you're putting in your body, right? I think that's
Give me
important.
another one. Give me another one. What
So
else?
let's throw some other things out there. Obviously, alcohol is one of the top ones
Okay.
that people, think may or may not um, pop up. But there's so many things that can cause a positive, possible positive toxicology
Mhm.
for alcohol. Um, there's some testing we can do for alcohol that's a little bit better, but you've got hand sanitizer extracts like vanilla extracts, over-the-counter
Mhm.
medications like NyQuil, I mean, near beer, kombucha. Kombucha is a real popular one right now.
Yes.
So I've had some colleagues not realize, there's kombucha out there that's, you know, uh, actually what they consider, I mean, it has all kombuchas, fermented, but some of this
Right.
is actually alcohol based versus non alcohol based, but they can both cause a positive alcohol test. And so, especially if you're somebody that is in a monitoring program,
Yeah.
um, that is so important to know. And of course, most monitoring programs should be, giving you a list of these things, which we do give you kind of a list of like, hey, these things you should really avoid because
Yeah.
we have to take every positive seriously if we can't rule out that it was the substance. And that can be a very frustrating for
Mhm.
an individual if they're like, it was hand sanitizer, but
A hand
we
sanitizer
oh
too?
yeah, alcohol-based hand sanitizer. And us nurses, we use that stuff like it's going out of
We
style. It
sure
can
do. And we love them good vanilla scents from a
oh
certain
yeah.
store that we like to go to. Oh, this is something
Uh,
else.
I mean, off the top of my head, the other one that is a real popular one, and it's the everything bagel. Have you seen the everything bagel seasoning? Um,
I've heard about that.
oh yeah. Well, it's got poppy seeds in it, and
Oh,
that's not fake news. That's a legitimate thing. You can actually have a positive toxicology test
that's
from
opioids positive, right?
absolutely.
A good lemon poppy seed
Yeah, good
muffin?
lemon poppy seed. You get those everything bagels down at our other favorite bagel shop. Now they sell that. It's delicious. They sell it, but it is one of the things to avoid if you are knowing that you're in monitoring or that could pop up on a toxicology
All
test.
right, this changes my Christmas gifts, and I be delivering gifts to my team. This changes salespeople when you out there delivering your little goodies. Leave them lemon poppy seed muffins alone. Leave certain bagels alone. Don't bring that to our office. We don't want them problems
We
today.
don't want to. No, no.
Yes. So Brittany, that was
Yes.
very enlightening because it's the little things that can cause you to trip up. Because most of the
Yeah,
time, you ain't gonna have a prescription for a CBD cream. I'm still stuck on this CBD moment.
I know.
The arthritis people that I know that are going to use those
Well,
creams.
it's everywhere. Yeah. I mean,
Yeah.
it's marketed well. They do a good job marketing. So, and
And I just
it's
learned about the kombuchas like last year that's supposed to be really good for your gut. Now that's another one. And it's
absolutely.
like, come
And
on.
again, like some of whether it's good or bad, that's why I always say, know what you're putting in your body. Talk to your provider. If you don't have one, go get one and say, hey, this is what's going on, so that you have,
Yeah.
whether it's a prescription, you have evidence that there's some documentation that you're being, followed, monitored, something that you can follow up with if it is a random um screening at work or and then we obviously give a little bit more information and detail to those that are in monitoring specifically that have prescriptions or any other medications that may cause a positive toxicology screen because we're very supportive of medication assisted treatment or medication for opioid use disorder, and so we do allow that in our program. But that's again, we're saying you've got to be followed by a physician so that we just have that objective documentation
Yeah.
showing we're fit to practice. Yes, this is prescribed. They're taking it as prescribed. And I would have the same feedback for any nurse with any kind of medication that may potentially cause them a little scare or a concern. Just have that ready to go so that you could show your employer if it ever came up.
So we have a lot of major businesses opening today in the outpatient sector, ambulatory infusion centers, home health agencies, lots of organizations that are opening that are hiring nurses that will have no clue what to do if a nurse comes up positive and how to support them. Does TPAPN ever offer any type of in services or offer to support these new companies or some companies that just had no real awareness that there's opportunities? How do they find TPAPN? And, for those that are listening to us in other states, what resources, what do you suggest that they do, especially for onboarding? Because I'm thinking that part of having a TPAPN program in whatever your states are should be a part of your orientation process so you make it safe if that nurse hits a moment, right, that we know that we have options. So what's the resource for that?
Yeah, so I love that. Absolutely. Just to answer the first question, will we do in services for work sites? Absolutely, we do. Right now, we do have an on-demand option, and all of the education that we do, because we are a nonprofit,
Mhm.
is free right now. So everything that we offer is free because we want to get this information out. We want to talk to employers about being what we consider TPAPN friendly, which is ultimately it's supporting your nurses through all levels of health, whether they're healthy, they need, assistance at the time they need to go through recovery. So we would love to do any and all opportunities to speak to employers about how to work collaboratively with TPAPN. We absolutely have things ready to go, and we can offer CE for that. We have an on-demand employer workshop available that's really worth checking out. But we also will come and do any, live Zoom, those kinds of things. And you find that through going to on our website. It's tpapn.org. You can request a speaker, and we will, do everything that we can to come out and make sure that, we can better inform you. But absolutely, Danielle, when you said new hire orientation, that is
Yeah.
something we talk about all the time because, again, so much, right? Even self-admittedly, and me and
Yes.
you both said we didn't know enough about this
Mhm.
program, and we had to kind of dig in to learn more. And
Mhm.
I find that so many, we go all across the state, talk to a lot of people, and there's still so many nurses that have been in the profession for years and no idea really about what TPAPN does or what alternative to discipline or peer support programs across the country do. And so, definitely, I would say reach out to your state, whatever state you're in. Reach out to your state board, ask about alternative to discipline, ask about peer support, see where that sits, and then get engaged with them for opportunities, but talk about it. Right?
Yeah.
Stop hiding this away in a dusty closet, broom closet somewhere that we don't ever talk about. And as leaders, it is, our responsibility to bring these topics out to also normalize this. And it might help somebody improve those help seeking behaviors by saying, hey, we're talking about this. Here's all the different resources that are available to you to hopefully help, intervene early and often. But in the event that you need extra support and monitoring, we're here for you, and this is what it would look like. So, from new hire orientation to annual training, I think it's incredibly important to be talking about how substance use and mental health impact our profession,
Mhm.
what kinds of resources each individual facility has, or
Mhm.
state, and looking at what can we do aside from putting the responsibility and onus on the individual nurse, right? As the profession and as employers, we have to own that and also figure out how we can better help.
I love that. Can you share a success story that demonstrates the power of early intervention and support?
Oh my goodness. Well, there's so many success stories that
Yeah.
I could share with you, and some of those, I never want to take the breath out of someone to share their own story, but I can tell you in this work, just in this short time, the amount of transformations that I have seen and the amount of just human kindness in the sense of nurses helping nurses, because that's one of the slogans that we do. The nurses in this program, and I'm going to say it again, are doing amazing things, and often they go on to lead even better initiatives. So one example, just broad, is a couple of our nurses, right, go on to and they become volunteers. So we have nurse volunteers that are peer support partners that we pair our participants with should they need that support. And those peer support partners are not spies for TPAP, and they're not eyes and ears. They truly are. Just I always
No,
like
they're
to say
not
that
spies.
they're not They are there if as a true, beacon of hope for
Yeah.
that individual, to inspire that, to offer understanding and compassion, and just be there as a resource for the nurse going through the program. And so I've seen some of our nurses, put together groups of their own, go on to inspire huge advocacy across the nation when it comes to this work, and really helping to give back. So I think, the outcomes when you get the support early, often, and you have peers that are understanding and compassionate and empathetic, well, even if they don't have a substance use diagnosis or other mental health, they can understand. I think inherently as nurses, we understand the stressors that
Mhm.
may lead someone to developing worsening symptoms of, substance use or other mental health conditions. And so there's so many stories. I couldn't name just one, but I can tell you that we have so many nurses that come through that succeed and go on to do huge things. And it's truly inspiring, um, just to see that happen.
I'm excited that you can say that you have so many success
Yeah.
stories. So that tells us that the program is working. So I'm gonna give I want to. This question is coming from the nurse manager and me, being a chief nursing officer. Um, what happens when I'm verifying somebody's license and it comes up with one of those orders on there? And I'm in an outpatient world, and what do I do? I get this question often. What do I do? Is this nurse no longer hireable? What happens? What's your advice for those nurse managers?
So I always say, because there's unfortunately in our state, depending on what's going on with that nurse, that order, like you're talking about, an order that would be a non-confidential order. Hopefully, this is, I guess, advice for the nurse manager, but then also nurses in general that may have orders.
Mhm.
Again, TPAPN is separate from the Board of Nursing. We have a very good relationship with the Board of Nursing, and sometimes nurses will actually have orders to
Mhm.
complete our program as a condition of they're maintaining their license.
Mhm.
Um, so if that happens, as a chief nursing officer, I would say please call us if it has anything to
Right.
do with TPAPN. If there's a TPAPN um, criteria on that order, call us and we will help move you through how you can be of support to that nurse, how we work collaboratively with our work sites and employers, and we ensure there are so many safety nets. I always say a monitor nurse is a safe nurse, and that we have
Yes.
so much objective data and safety nets and holistic, support around these nurses that you're gonna you're going to be more informed on a day-to-day basis if they're well and healthy than you would your nurses that are not in a monitoring program,
Yes.
right? So don't view it, I guess my best advice is, if you see that, please give those nurses a chance. Please talk to us. Please call us. There is a way through. We have done it. There are some hospitals doing amazing, amazing things that
Yes.
are so pro nursing, and they have had great success in working with us. Those nurses, they're going to be so, I mean, what we see anecdotally is that when there's an opportunity given, you're going to get that back tenfold as an employer. You know, yes,
Yeah.
I talk about recovery is not always, it's not linear in anything that we do, right? And so there's perhaps when questions that I will get is, what if somebody has a lapse or a relapse? Well,
Yes.
we're going to hopefully, when toxicology testing is going to help show that, as well as other objective um, data that we can see when we're helping, monitor that nurse. And we're going to work with them and the employer and say, hey, we may have to pull from practice temporarily. Let's get them reevaluated and back on track. Just like we would with any medical condition that's treatable. If there was something that came up and their treatment plan was not working, we
Mhm.
would we wouldn't just,
Mhm.
okay, that's it, right?
Mhm.
Bye. We're no longer going to work with you, but we
We're
would
we're
say,
good when it comes down to dealing with that on the patient side.
Exactly.
It's the transference of that on nurse to nurse and caring for each other and truly seeing each other. And I wanted to lift that question up because we have so many amazing nurses that the door closes on them because the managers don't understand what next steps do I need to do? How do I work through this? And I wanted managers to know that pick up the phone,
Pick
make
up the
some
phone.
phone calls, be
Call.
willing to see how this can happen. This is your fellow nurse.
Yep.
Support them. See how we can work together as a team. So, as we get ready to close out, I want to recognize that we had some comments. So, Aisha Smith, thank you for being here. She says that this is an amazing, this topic is so important. She highlighted, yep, work related trauma. That's the thing, right?
Yes, it
And
is.
then she
Yeah.
said, wow, I need to be more mindful doing my pedicures. You working as a nurse in some of these hospitals, you better
Uh-huh.
watch what you choosing for them pedicures, them CBD products. Nurses, put them CBD products down.
Yep. Yep.
All right. So if every nurse remembers one message from today, Brittney,
Yeah.
what do you hope it is?
I hope they remember you're not alone. If you are struggling, if you need help, please know you are not alone. No matter where, what state you're in, reach out to, your peer assistance groups, reach out to your associations, reach out to your network and know that there are people out there that are working on your behalf. Monitoring, I'm here to say it is not easy. This work of recovery and going through recovery is not easy, and you will never hear me say that it is. Our nurses work very hard, but you are not alone. And please also take care of yourself, right?
Yeah.
Please take care of yourself. That employer won't punish you if you don't pick up that extra shift. Drink your water, support one another,
Yeah.
and know you're not alone.
I love it. So as we get ready to close out, here's the rapid fire moment. So I'm
Oh,
going to
okay.
ask you these questions. Don't be overthinking it. The first
Okay.
thing that
Okay.
comes to your mind, that's your answer. So,
Okay.
coffee or tea?
Ooh. Coffee in the morning, tea in the afternoon.
Is one.
Oh, coffee. Coffee.
Beach or mountains?
Mountains.
Morning person or night owl?
Oh, morning.
Favorite way to recharge?
Get outside.
One word that describes nursing today.
Adaptable.
Ooh, one quality every great nurse should have.
Balance.
Love it. One habit that protects your mental health.
Boundaries.
Couldn't find my little button. Go. "Brrr." Yeah,
Yay!
yes. Boundaries, nurses. Get you
Boundaries.
some.
Let's get them.
All right. A book every nurse should read.
Oh gosh. One that brings you joy. I'm a fiction, so I'm an escape reader. So I read a ton of Kristen Hanna or anything that's fantasy fiction. So
Hey, that's one book that lets you escape,
there
right?
we go.
We're so serious all the time. So hey, all right,
Exactly.
I got it. I'll throw out a book, Henry Boundaries. I believe it's by Henry Cloud. That book changed my life.
Oh, that's a good one. Okay.
Yeah. So what motivates you to continue advocating for nurses?
I think it's just all the sacrifices that I have seen and the work that I have seen our nursing colleagues make to help others. I genuinely do. I think nursing deserves the same kind of care that we often give to others every single day.
I love it. Finish this sentence, Brittney. Every nurse deserves.
I'm going to go back to balance. I think it's important.
All right. You heard it here today. And for those of you in the audience listening to this now or later, here is an engagement question for you that I want you to comment on. What is one thing you learned today after watching this video that every nurse should know? Share it in the comments and tag another nurse who needs this conversation. Thank you, Brittney, for helping break the stigma around mental health in nursing. And to everyone listening, remember, seeking help is never a sign of weakness. It's the one strongest decision a nurse can make. Until next time, continue leading, serving, and owning your piece of healthcare. Goodbye for now.